Today, society is facing unprecedented health challenges. Cardiovascular disease continues to reach new highs, literally driven by activity being designed out of our lives. Now, sedentary lifestyles have become the norm for many people. Mental health challenges are also escalating, especially among youth and young adults on college campuses who suffer from stress, anxiety, and depression. For the first time in decades, the average life expectancy for Americans is declining. As doctors and public health professionals search for solutions, one promising possibility is often overlooked. What if a potential solution to all of these problems was free, widely accessible, and right outside our front door?
People have recognized the healing power of nature for thousands of years. Early societies often turned to herbal remedies and natural healers, a practice that continues in many indigenous cultures. The Greek physician Hippocrates frequently prescribed garden walks and forest visits to help his ailing patients. Transcendentalist Henry David Thoreau once remarked that nature is another word for health. More recently, the Japanese government officially embraced the ancient practice of Shinrin-yoku, or forest bathing, as a health promotion strategy. Yet despite general appreciation of the therapeutic benefits that nature provides, our modern healthcare system has been hesitant to embrace nature as a viable form of treatment. Our team here at NC State is hoping to change that. My conservation social science research and teaching focus on promoting sustainable human-environment interactions and fostering healthy relationships between people and nature. I started my career as a wildlife biologist, spending time outdoors in remote parks around the world. But I learned two things from these experiences. First, I really enjoy interacting with people, so a field biology career wasn't the right fit for me. And second, the time I was spending out in nature, away from screens and other distractions, was really important for my mental and physical health. I later decided to explore those connections as part of my research agenda.
When talking about links between nature and health, it's important to define nature. We often think of it in terms of green spaces, like the one I'm in right now. Green spaces might be natural ecosystems such as forested areas, but they can also include built environments with natural elements like a public park or a private backyard or even a street-lined sidewalk. They may also not be green spaces at all, such as blue spaces next to water or lakes, white spaces such as in snow and ice, or brown spaces like an arid landscape. Each of these provide their own natural benefits based on individual preferences and your own sense of place. Our work has shown that green spaces are especially important for physical health. They create environments that support active lifestyles and improve access to recreational opportunities. I, for example, love walking, running, even having meetings along our greenways here on NC State's campus. Nature-based recreation activities improve cardiovascular health by mitigating risk factors such as high cholesterol, hypertension, and obesity. Green spaces also provide a variety of ecosystem services by doing things like improving air quality and regulating temperature, all of which impact our health as well. These benefits can be experienced by people that are both physically in parks and green spaces, as well as communities that live near them.
Parks and green spaces are also important for mental health. Research shows that people who spend more time in nature enjoy enhanced cognitive functioning and reduced stress. They're also less likely to display anxiety disorders and depression, and more likely to report high levels of happiness and well-being. In fact, one of our studies found that the happiest cities in the US are the ones with the most parks. Connection to nature also facilitates positive social and emotional development too. Parks and green spaces create spaces where people gather and interact to build social cohesion and foster social capital. This is particularly important on campuses like NC State's. Green land cover also yields economic benefits and has been linked to lower levels of healthcare spending and higher levels of financial well-being and security. These benefits have been especially evident during the COVID-19 pandemic, where our research has consistently shown that individuals and communities who had access to parks and green space demonstrated better health outcomes and a heightened ability to cope than those who weren't able to use or access these areas.
Here at NC State, we work with partners around the country and internationally, such as the National Park Service's Healthy Parks, Healthy People program and park prescription programs to develop and improve tools and approaches that support nature-based health promotion. Our work has also shown that despite the capacity of parks and green spaces to improve health behaviors and outcomes, these resources often remain inequitably distributed across diverse communities. Neighborhoods with low income or racial and ethnic minority residents typically experience limited access to quality parks and green spaces. These disparities have only grown during the COVID-19 pandemic, underscoring the importance of ensuring that benefits of parks and green spaces are accessible to and enjoyed by all segments of society.
While our research program at NC State is helping to transform the way public health professionals and policymakers think about health promotion, we're also working to create new opportunities so that members of the NC State campus community can experience these benefits. For example, Dr. Hipp and I created a nature, health, and wellness class for students who want to explore these connections and discover ways to improve their own physical, mental, and social health through contact with nature. One of our class field trips comes right here to visit the Lake Raleigh Woods, and we're always excited to work with students on new research projects that investigate nature and health connections.
The health-related benefits generated by parks and green space may be more conspicuous in the wake of the COVID-19 pandemic than ever before. At this critical juncture, we need to embrace the value of nature-based interventions at both the individual and the community level. We should all spend more time outdoors. And we believe we should support policies and programs that facilitate equitable access to quality parks and green spaces for everyone.
Although our work continues, the current evidence is clear. Nature represents a cost-effective alternative to many conventional health promotion strategies. If someone is suffering from health problems, the easiest treatment might be just a few steps outside. Parks and green space are key to supporting a healthier and happier population. At NC State, you can join us and become part of this natural solution.